Blood transfusion reactions in anesthesia. Understanding. Types, signs, management, and complications. Blood transfusions are a common practice in anesthesia care, but they can also lead to serious complications. Transfusion reactions can occur due to various factors, including blood incompatibility, allergic responses, and circulatory overload. Identify the types of blood transfusion reactions. Recognize the signs and symptoms of transfusion reactions. Understand the management and treatment of transfusion reactions. Discuss the potential complications of transfusion reactions. Introduction. 1. Blood transfusion is a life-saving intervention, but it carries risks. 2. Transfusion reactions can occur and pose significant challenges during anesthesia. 3. This presentation provides an overview of transfusion reactions, their impact in anesthesia, and management strategies. Blood transfusions are a crucial medical intervention, but they come with risks. Specifically, 1. Risk of transfusion reactions. Transfusion reactions can occur, posing significant challenges. 2. Impact on anesthesia. These reactions can have a substantial impact during anesthesia. 3. Need for management strategies. Effective management of transfusion reactions is essential. This presentation will provide an overview of transfusion reactions, their impact on anesthesia, and strategies for management. What is a blood transfusion reaction? 1. A blood transfusion reaction is an adverse response of the body to transfused blood products. 2. It can range from mild to life-threatening. A blood transfusion reaction occurs when the body responds negatively to transfused blood products. This adverse response can range from mild, skin rashes, itching, or mild fever. Severe, life-threatening complications, such as anaphylaxis, respiratory failure, cardiac arrest, renal failure. Prompt recognition and management of blood transfusion reactions are crucial to prevent serious complications and ensure patient safety. Classification of transfusion reactions. Acute, within 24 hours. 1. Hemolytic reaction. 2. Febrile non-hemolytic. 3. Allergic reaction. 4. Anaphylaxis. 5. Transfusion-associated circulatory overload (TO). 6. Transfusion-related acute lung injury (Trali). Transfusion reactions can be classified into two main categories, acute and delayed. Here are the acute transfusion reactions that occur within 24 hours. 1. Hemolytic reaction, destruction of red blood cells, which can be life-threatening. 2. Febrile non-hemolytic, fever, chills, and discomfort due to white blood cell incompatibility. 3. Allergic reaction, mild to severe allergic responses, such as hives, itching, and anaphylaxis. 4. Anaphylaxis, severe, life-threatening allergic reaction. 5. Transfusion-associated circulatory overload (TACO), fluid overload, leading to respiratory distress and cardiac failure. 6. Transfusion-related acute lung injury (Trali), respiratory distress, hypoxemia, and non-cardiogenic pulmonary edema. Prompt recognition and management of these acute transfusion reactions are crucial to prevent serious complications and ensure patient safety. Remember, vigilance and quick action can save lives. 2. Delayed, after 24 hours. 1. Delayed hemolytic reaction. 2. Graft versus host disease, GVHD. 3. Iron overload. 4. Post-transfusion purpura. These reactions occur after 24 hours of transfusion and can be just serious as acute reactions. 1. Delayed hemolytic reaction, destruction of red blood cells, which can occur days to weeks after transfusion. 2. Graft versus host disease, GVHD**, a rare, potentially life-threatening reaction where donor immune cells attack the recipient's body. 3. Iron overload, excessive iron accumulation in the body, leading to organ damage and other complications. 4. Post-transfusion purpura, a rare bleeding disorder that occurs when the immune system attacks platelets. Delayed transfusion actions can be subtle and may not always be immediately apparent. Vigilance and monitoring are crucial to detecting and managing these reactions. These reactions can happen days, weeks, or even months after a blood transfusion. Acute hemolytic reaction. 1. Caused by ABO incompatibility. 2. Symptoms: fever, chills, hypotension, hemoglobinuria. 3. Management: stop transfusion, IV fluids, diuretics. This reaction is caused by ABO incompatibility, wrong blood type. Symptoms: fever, chills, low blood pressure, hypotension, hemoglobin in urine, hemoglobinuria. Management: stop the transfusion immediately, give IV fluids to help flush out the blood, use diuretics to increase urine production. This reaction is life-threatening and requires immediate action to prevent serious complications or death. Febrile non-hemolytic reaction. 1. Most common reaction. 2. Caused by cytokines from donor leukocytes. 3. Symptoms: fever, chills. 4. Management: stop transfusion, antipyretics. This reaction is the most common type of transfusion reaction. Caused by cytokines released from donor white blood cells, leukocytes. Symptoms: fever, chills. Management: stop the transfusion. Give antipyretic medications, e.g., acetaminophen, to reduce fever. This reaction is usually mild and self-limiting, but it's still important to stop the transfusion and manage symptoms to ensure patient comfort and safety. Allergic reaction. 1. Caused by recipient's immune response to donor proteins. 2. Symptoms: urticaria, itching. 3. Management: antihistamines, continue transfusion if mild. This reaction occurs when the recipient's immune system overreacts to proteins present in the donated blood. Symptoms can include hives, urticaria, itching, redness, swelling. Management typically involves administering antihistamine medications to relieve symptoms and reduce the allergic response, closely monitoring the recipient's condition, continuing the transfusion if the reaction is mild and symptoms are well controlled. In general, allergic reactions to blood transfusions are usually mild to moderate and can be effectively managed with medications. However, in severe cases, the transfusion need to be stopped to ensure the recipient's safety. Anaphylactic reaction. 1. Severe allergic reaction due to IgA deficiency. 2. Symptoms: hypotension, bronchospasm, shock. 3. Management: stop transfusion, epinephrine, steroids. This reaction is a severe life-threatening allergic response, often caused by an IgA deficiency or other underlying immune system disorders. Symptoms can include rapidly falling blood pressure, hypotension, constriction of the airways, bronchospasm, shock, difficulty breathing, abdominal cramps, nausea and vomiting, rapid heartbeat. Management requires immediately stopping the transfusion, administering epinephrine, adrenaline to help relax the airways and improve breathing, giving steroid medications to reduce inflammation and swelling, providing oxygen therapy to support breathing, maintaining blood pressure with fluid resuscitation and vasopressor medications. Anaphylactic reactions are medical emergencies that require prompt recognition and treatment. If not managed properly, they can lead to serious complications, including respiratory failure, cardiac arrest, and even death. Transfusion-associated circulatory overload, TACO. 1. Volume overload in patients with cardiac, renal impairment. 2. Symptoms: hypertension, pulmonary edema. 3. Management: diuretics, oxygen, slow transfusion. TACO occurs when a patient receives too much blood or fluid too quickly, leading to volume overload. Often affects patients with pre-existing cardiac or renal impairment, as their bodies are less able to adapt to excess fluid. Symptoms can include high blood pressure, hypertension, fluid buildup in the lungs, pulmonary edema, shortness of breath, coughing, fatigue, confusion. Management involves administering diuretic medications to help remove excess fluid from the body, providing oxygen therapy to support breathing, slowing down the transfusion rate to prevent further volume overload, monitoring the patient's vital signs and cardiac function closely, considering the use of vasodilator medications to help reduce blood pressure. Prevention is key. Assessing patients for risk factors before transfusion. Using conservative transfusion strategies. Monitoring patients closely during and after transfusion. TACO is a serious complication that can lead to respiratory failure, cardiac arrest, and even death if not recognized and managed promptly. Transfusion-related acute lung injury. Trali. 1. Non-cardiogenic pulmonary edema. 2. Symptoms: hypoxia, respiratory distress. 3. Management: oxygen, mechanical ventilation if needed. Trali is a serious and potentially life-threatening complication of blood transfusion, characterized by non-cardiogenic pulmonary edema, meaning that the lungs become inflamed and filled with fluid, but it's not caused by heart failure. Symptoms can include low oxygen levels in the blood, hypoxia, respiratory distress, shortness of breath, coughing, chest tightness, rapid breathing rate. Management involves providing oxygen therapy to support breathing, mechanical ventilation if necessary to help the patient breathe, fluid management to prevent further fluid overload, monitoring the patient's vital signs and oxygen levels closely, considering the use of diuretics to help remove excess fluid from the lungs. Prevention is key. Using plasma from male donors or donors who have been tested for HLA antibodies. Implementing a transfusion protocol that minimizes the use of high-risk plasma. Monitoring patients closely during and after transfusion for signs of Trali. Trali is a medical emergency that requires prompt recognition and treatment. If not managed properly, it can lead to respiratory failure, organ dysfunction, and even death. Delayed hemolytic reaction. 1. Mediated by alloantibodies. 2. Symptoms: mild jaundice, fever. 3. Management: monitor, supportive care. Delayed hemolytic reaction is a type of transfusion reaction that occurs when the recipient's immune system reacts to the donated blood cells. Mediated by alloantibodies, which are immune system proteins that recognize and attack foreign substances. Symptoms can include mild jaundice, yellowing of the skin and eyes, fever, fatigue, weakness, dark urine, pale stools. Management involves monitoring the patient's condition closely for signs of hemolysis, red blood cell destruction, providing supportive care, such as fluid replacement to prevent dehydration, pain management to alleviate discomfort, rest and relaxation to help the body recover. In some cases, additional treatments may be necessary, such as blood transfusions to replace damaged red blood cells, medications to reduce inflammation and prevent further hemolysis. Prevention is key. Ensuring accurate blood typing and cross-matching minimize the risk of an adverse reaction. Screening donors for alloantibodies to reduce the risk of transmitting them to the recipient. Monitoring patients closely during and after transfusion for signs of a delayed hemolytic reaction. Delayed hemolytic reactions can be serious and potentially life-threatening if not recognized and managed promptly. Graft versus host disease, GVHD. 1. Occurs in immunocompromised patients. 2. Symptoms: rash, liver dysfunction, pancytopenia. 3. Management: prevent with irradiated blood. GVHD is A rare, potentially life-threatening complication of blood transfusion occurs when the donated blood cells, the graft, attack the recipient's immune system. The host typically affects immunocompromised patients, such as those with cancer, HIV, AIDS, or taking immunosuppressive medications. Symptoms can include skin rash or lesions, liver dysfunction or failure, pancytopenia, low blood cell counts, diarrhea, vomiting, abdominal pain, weight loss, fatigue. Management involves prevention is key. Using irradiated blood products can reduce the risk of GVHD. Irradiation of blood products damages the lymphocytes, making them unable to cause GVHD. In cases where GVHD does occur, treatment may involve immunosuppressive medications to reduce the immune response, supportive care, such as fluids, antibiotics, and pain management. In severe cases, hospitalization may be necessary. High-risk groups: immunocompromised patients, patients with cancer or receiving chemotherapy, patients with HIV, AIDS, patients taking immunosuppressive medications. Prevention and early detection are crucial in managing GVHD. Iron overload. 1. Common in chronic transfusions. 2. Symptoms: liver, heart damage. 3. Management: iron chelation therapy. Iron overload. Excess iron accumulation in the body. Common in patients with chronic transfusions, such as those with sickle cell disease or thalassemia. Symptoms: liver damage, heart damage, endocrine problems, joint pain, skin changes, fatigue, weakness. Management: iron chelation therapy, medications that remove excess iron, monitoring iron levels and organ function, avoiding vitamin C supplements. Prevention: regular iron level monitoring, early iron chelation therapy, alternative treatments to reduce transfusion frequency. Early detection and treatment can prevent long complications and improve quality of life. Post-transfusion purpura. 1. Severe thrombocytopenia after transfusion. 2. Symptoms: purpura, petechia, nosebleeds. 3. Management: IV immunoglobulins, steroids. PTP is a rare but serious complication of blood transfusion, characterized by severe thrombocytopenia, low platelet count, occurring 5 to 10 days after transfusion. Causes: immune system reaction to transfused platelets, destruction of recipient's own platelets due to alloantibodies. Symptoms: severe thrombocytopenia, purpura, bleeding under the skin, petechia, small red spots on the skin, easy bruising, nosebleeds, gum bleeding. Management: intravenous immunoglobulins, IVIG, to neutralize alloantibodies, steroids to reduce inflammation and immune response. Platelet transfusions may be necessary in severe cases. Monitoring of platelet count and bleeding symptoms. Prevention: using leukoreduced blood products to reduce the risk of alloimmunization. Implementing measures to reduce the risk of transfusion-related immune system reactions. Early recognition and treatment of PTP are crucial to prevent severe bleeding complications and improve patient outcomes. Blood transfusion reactions in anesthesia. 1. Intraoperative reactions can mimic anesthesia complications. 2. Close monitoring of vital signs is essential. 3. Hemolytic reactions may present as unexplained hypotension. 4. Trali can cause acute respiratory distress during surgery. 5. Prompt recognition and management are crucial. Blood transfusion reactions in anesthesia can occur during surgery, and anesthesia may mimic anesthesia complications, making diagnosis challenging. Close monitoring is key. Monitor vital signs closely. Recognizing reactions. Hemolytic reactions. Unexplained hypotension, tachycardia, fever, chills, hemoglobinuria. Trali. Acute respiratory distress, hypoxemia, bilateral traits on chest X-ray. Prompt action is crucial. Stop transfusion immediately. Notify anesthesia and surgical teams. Provide supportive care, oxygen, fluids, etc. Prevention. Ensure accurate blood typing and cross-matching. Use reduced blood products. Monitor patients closely during and after transfusion. Immediate management of transfusion reactions. 1. Stop transfusion immediately. 2. Maintain IV access with normal saline. 3. Monitor vital signs. 4. Administer appropriate medications based on reaction type. 5. Notify blood bank for investigation. 6. Provide supportive care, oxygen, fluids, pressors if needed. Immediate management of transfusion reactions. When a transfusion reaction occurs, act fast. 1. Stop transfusion immediately. Discontinue the transfusion right away. 2. Maintain IV access. Keep the IV line open with normal saline for meds and fluids. 3. Monitor vital signs closely. Track blood pressure, heart rate, oxygen saturation, and more. 4. Give meds based on reaction type. Use antihistamines, epinephrine, or steroids as needed. 5. Notify blood bank ASAP. Inform them to investigate the cause. 6. Provide supportive care. Offer oxygen, fluids, pressors, and cardiac monitoring. Additional steps. Ask. Document everything. Record symptoms, vital signs, and treatment. Notify the healthcare team. Inform them about the reaction and treatment. Review transfusion protocol. Identify errors and areas for improvement. Remember, prompt action saves lives. Prevention of transfusion reactions. 1. Strict blood group matching and cross-matching. 2. Leukoreduction for febrile reactions. 3. Pre-medication in patients with previous reactions. 4. Slow transfusion rates in high-risk patients. 5. Use of irradiated blood for immunocompromised patients. Prevention of transfusion reactions. To ensure patient safety, follow these preventive measures. 1. Match blood groups carefully. Verify patient's blood type and cross-match blood. 2. Remove white blood cells. Leukoreduction reduces risk of febrile reactions in Trali. 3. Pre-medicate high-risk patients. Give antihistamines or corticosteroids before transfusion. 4. Use slow transfusion rates. For high-risk patients, such as those with cardiovascular disease. 5. Irradiate blood components. For immunocompromised patients, such as those with cancer. Additional measures. Screen blood donors for infectious diseases. Use low-risk Trali blood components. Monitor patients closely during and after transfusion. Establish a transfusion protocol. By following these measures, healthcare providers can minimize the risk of transfusion reactions and ensure safe blood transfusions. Conclusion. 1. Blood transfusions are life-saving but carry risks. 2. Anesthesia providers must recognize and manage transfusion reactions. 3. Preventive strategies are crucial to reducing complications. 4. Prompt intervention can save lives. Blood transfusions save lives but carry risks. Anesthesia providers must 1. Recognize transfusion reactions. Know signs and symptoms. 2. Manage reactions promptly. Use evidence-based guidelines. 3. Communicate clearly. Inform surgical team. Blood bank. Prevention is key. Strict blood typing and cross-matching. Leukoreduced blood components. Pre-medication for high-risk patients. Irradiated blood for immunocompromised patients. Close monitoring during and after transfusion. Prompt intervention saves lives. Stop transfusion immediately if reaction suspected. Administer oxygen, fluids, and medications as needed. Notify blood bank and surgical team. Provide supportive care as needed. By being proactive, Anesthesia providers can prevent complications, ensure intervention, and improve patient outcomes. Thank you. Transfusion reactions are, like storms, unpredictable, potentially devastating, and requiring swift action. To prevent catastrophe, vigilance, knowledge, and prompt intervention are the lifelines that can calm the storm and save lives. Question time. Ask me any question. Thanks for watching. Like, comment, and subscribe for more content.